In the news, a teenager had to be hospitalized because of Rapunzel syndrome, which sounds a lot better than it really is. Rapunzel syndrome is when you get a hairball in your stomach, which grows so big that some of the hair dangles down into the small intestine. And I'm not just talking like a few strands of hair that are dangling. I'm saying like this hairball grows into a mass that is so big that some of it extends into the duodenum. How would somebody end up with a hairball in their stomach? Well, it's likely because they're eating their hair. Trichotillomania is the uncontrollable urge to pull out your hair. A surprising number of people have this. It's estimated 1 to 2%, and it's usually girls and young women. Celebrities like Amy Schumer recently came out and said that she has trichotillomania. It's a cause of a lot of shame and embarrassment for people who suffer from this. They end up with bald spots potentially, but it gets worse if they eat the hair. That's called trichotillophagia, and you can end up with a hairball in your stomach. It's called a bezoar, like from Harry Potter, except that it's in your stomach. It's similar to a hairball that your cat might get, except that humans aren't able to deal with it. We can't digest hair, and we don't have the mechanism to puke it up like a cat does. So it just grows and grows and grows in your stomach. You know how after you wash your hair and you end up with a clump of hair in the shower drain and you can kind of roll it together and it forms a hard ball? Am I the only one who does this? You're essentially felting your hair, and that's what goes on in your stomach if you end up with a lot of hair in there. Your stomach is this wet environment that it's just grinding it all together. You're essentially compacting it and making it into a human felt hairball. So in this case with this teenager, she went to the hospital multiple times before the doctors figured out that it was Rapunzel syndrome. It caused stomach pain and vomiting, and she was tender. They ended up removing a 2.5-inch hairball, which sounds much bigger than I would want in my body, but honestly, I've been Googling this and I've seen way bigger. Trichotillomania can be treated with a form of cognitive behavioral therapy called habit reversal training, but unfortunately the girl in this story decided not to go for any of her follow-up psychiatric treatment. Instead, she was going to do hypnotherapy. I wish her well. This is a bit of an unusual story for me to cover on the Detangler. Ordinarily, I look at art and rituals and legends and rules that deal with hair, but this is more of a science story. So what do you think? Should I do more stories like this, or do you want me to stay in my lane? Thank you for watching, and thank you to my loyal Detangler follower, Michael, for sharing this story with me. Like and subscribe if you haven't already.